Now we'll discuss what every woman needs to know if she is using or considering the use of a contraceptive. First, she should understand different categories or types of contraceptives. There are barrier methods which block or kill the man's sperm and prevent it from entering the woman's uterus, so that the sperm cannot travel up the fallopian tubes to meet and fertilize an ovum. Hormonal contraceptives. These are pills, patches, and injections which attempt to prevent ovulation and thicken cervical mucus, which prevents the sperm from entering the uterus. But these hormonal contraceptives also have another effect, which is not contraceptive. That is, if their contraceptive function fails and an embryo is created, they cause the death of the embryo by creating a hostile environment in the uterus. Then there are the Larks, long-acting reversible contraceptives. Although these are hormonal contraception, they deserve a special category because they are long-lasting. Plan B, sometimes called the morning after pill. These also deserve a special category, which we will address. Then there are fertility awareness methods. These are not really contraceptives, but they are methods that can be used to either achieve or postpone pregnancy. Because they are an alternative to contraceptives, we discuss these also. There are several fertility awareness methods. For each of the methods of contraceptives, I will discuss the mechanisms, effectiveness, and risks. Mechanisms. I have touched on this. The mechanism is the process by which the so-called contraceptive prevents or terminates pregnancy. Effectiveness. There is perfect use and typical use effectiveness. Perfect use is when the contraceptive is used perfectly, uniformly, and 100% consistently. Typical use effectiveness is the rate when used by the average person or couple, which is not 100% uniformly or consistently. Risks and side effects. When we speak of risk, we speak of the risk of disease, serious injury, or death. Included in this is the risk of sexually transmitted infections. These are indeed life-threatening and killers. None of the methods of contraception except condoms protect against sexually transmitted infections. And, as we'll discuss, even condoms are nowhere near 100% effective at preventing sexually transmitted infections.